Good morning. Good morning. I've got a bunch of slides here, so I'm going to move pretty quickly. What I'm going to do is explain to you what's driving our health insurance costs and then a little bit about what you can do about it as an employer. So if you look at the United States, we spend about twice as much as any other developed nation on health care. And so you might ask yourself, why is that? And so, do we have more acute care beds than any other developed nation? Well, actually, no. We have on average less than any other developed nation. You look at practicing physicians per thousand of population, we have about average. Percent of population over 65, we're about average. We have fewer than a lot of developed nations. But then the one area where we lead is in our obesity rate. If you look at that for males, females, and percentage of total population, we have double the percentage of obese people in the United States than any other developed nation. And that's really what's driving our health insurance costs. Okay, if you look at this slide here, this just gives you some facts. This is actually from Cigna, but the one on the upper right-hand corner, 1 of every 3 children in the United States born after 2000 will develop diabetes by age 50. And the driving thing behind that is just our lack of exercise and poor nutrition. This just gives you an idea. If you're an employer or you're an employee that's discouraged about the fact that your health insurance costs are going up, really there's a concept called the total cost of your health care. And medical and pharmacy costs are only 25% of that cost if you're an employer. And really there's a bunch of hidden costs or other costs connected with the health and the productivity of your employees that you may not necessarily realize. And so it's workers' comp costs, long-term disability, short-term disability, absenteeism, and there's a concept called presenteeism. This is all from the University of Michigan, really. And they're the leaders in the research on health and productivity. They've been doing it for 30 years. They have a health management research center is the arm of their university that develops all this research. But presenteeism, when someone is not physically fit and they come to work, you may be sick or they may just not be 100%. They come to work and they're there 8 hours, but they may give you 4 hours worth of work. These are health risk factors, and so 70% of the claims that you pay as an employer or that your employer pays are the result of the poor lifestyle decisions that your employees make. And the leading to are poor nutrition and lack of exercise. You see all the other ones: high stress, high cholesterol, lower back pain, all these different things, smoking. They're risk factors that drive your health insurance costs. So that's what they use when the scientists analyze the health risk of your population. They use something called risk factor accounting. This gives you a little bit of an idea from a workers' comp perspective. The last bullet point there, a study recently done by Duke Medical University showed that obese workers filed twice as many workers' comp claims, had 7 times higher medical costs from those claims, and had 13 times more days off from those as a result of those injuries. This is from the University of Michigan also. When they stratify your workforce, what they do is they look at how many risk factors a person has. So a risk factor is high blood pressure, high cholesterol, sedentary lifestyle, poor nutrition. So one person on the left that's low risk, from 0 to 2 risk factors, they average about $2,200 a year in health care costs. Person on the right that has 5 or more risk factors averages $5,500 a year of health care costs, so $3,300 more because they have more risk factors. So when you're managing the population of your company, what you're trying to do is help employees identify what those risk factors are and then manage them one at a time. So take them, if they have 5, help them manage 1 and move so they have 4 and then 3. And so the healthier and the fewer risk factors your employee population can have, the lower that your health insurance costs are going to be over time. This just shows the same thing for disability costs. As the number of risks, health risks a person has, the higher their disability insurance cost is going to be for your company. and this is the same thing for short-term disability, workers' comp, absenteeism, medical and pharmacy, and the total. So there's copies of these slides at the back, actually. I don't want to bore you with each detail, but let me see how we get this one. Okay. This is 70% of chronic diseases are preventable, and really from year to year, 5% of your employees, what this is showing is 5% of your employees in your company will be responsible for 50% of the healthcare costs. And the thing is that 5% is not the same 5% of people every year, because different people have spikes in healthcare costs as time goes on. So what the best systems in the industry try to do is identify who that 5% is going to be 24 or 36 months in advance, and then have health coaching. This is all, got to be HIPAA compliant, and you have a third party that does health coaching that will contact those people and say, hey, we insure large commercial construction companies, our company does, and there's about 3,000 employees in our group. In 2007, we paid roughly $3 million for cancer claims. That was our biggest item, single area where we spent money. And so we started looking at, well, why are we spending so much money in cancer? And when we looked at it, we said on the left-hand side, you see 28% of the females in our group received breast cancer screenings, and the benchmark, we're supposed to have 75% of them receiving their screenings. Okay, so we only had 28%. We had 34% got cervical cancer screenings, the benchmark is 81, and 14 got colon cancer screening, the benchmark is 44. So what we were doing is we weren't catching anybody early. By the fact that none of our people were getting their screenings done, we weren't catching anybody early. So having that data then, what we did is put in some incentives to where if people went and got their screenings, we gave them incentives. They might get a gift card or whatever. We paid for it 100%. And so what we're doing is hoping over time that's going to reduce our health care costs. This shows for congestive heart failure, a lot of people that have a disease won't necessarily take care of themselves. If it's a diabetic or whatever, they won't see the doctor like they're supposed to. They won't take their medication. And this is just an example for people with us that had congestive heart failure. 25% of them were compliant with the disease management program that we had in place. They saw the doctor, they took their medication, they did what they were supposed to do. Those people on average cost us about $16,000 a year. And the people that were not compliant, 75% of them were not compliant, and those people on average cost us about $21,000 a year. So the idea is to help people get engaged, obviously, in their own care. I mean, that's the whole big wave of what's going on right now in healthcare. It's similar to automobile insurance, right? If you had an automobile, if you could go